Good morning. Yes, good morning, Sitaraman. Welcome to all our brothers and sisters out there listening, both in Trinidad and Tobago, of the Caribbean, and wherever this program is, whichever platform it is posted on. And I want to let our listeners know that this program will be repeated again at 10 p.m. tonight on the same media house, on both radio and TV Jagriti. And soon after the program, it will be posted on YouTube and Facebook. So those of you who are unable to listen to it in its entirety this morning, you can always come back to it. And it is being posted there as a resource that will always be there, so that if you know anyone or have a relative, a sibling, who you think may benefit from the information we are sharing here this morning, then you can always give them the link, or you can call the station or myself. My number is on the screen, and I'd be happy to share that information with you. I also want to let our listeners know that this is an interactive program, and you are free to call at any time during the course of the program. And if you have questions for me or my host, you're quite welcome to do so. And as I say that, we are so fortunate this morning to have a gentleman who is on the other screen with me, Mr. Jefferson Jurawan. He's a person that I have known for a very, very long time, who has gone ahead and educated himself at a lot of personal effort. And today he's a clinical psychologist. He is the chairperson of the Rebirth House in Trinidad and Tobago. A lot of you must have heard about Rebirth House. Some of you might have benefited, some of your families and so on. He's here to talk a little bit about Rebirth House, his role, the program there. And in this program over the last few weeks, we have been featuring the resources that are available to our public in Trinidad and Tobago. And when I say that, I recall how fortunate we are, having experienced what happens in the rest of the Caribbean. We are very fortunate in Trinidad to have so many different types of resources. We have, and Rebirth House is one of those places, as Mr. Jurawan will tell you in a little bit, has been historically significant in this community as one of those NGOs that came forward a very long time ago to supplement what government was doing here. So without any further ado, I want to say hello and welcome to Mr. Jurawan, who is here with us this morning. I know there is a long list of things I can say about you, Jeff, if you don't mind me calling you that on the program sometimes. Jefferson has been a guidance officer with the Ministry of Education. He has been a lecturer at COSTAT. He has his own private practice in several places in Trinidad, Central and North. And he has been providing human service to the Rebirth House in terms of being a clinical psychologist there. He's also an expert at addiction counseling. We are both in the same field, And I think, Jeff, we need much more people like yourself with the hands-on experience that you have had to be able to contribute to the discussion this morning. So that I would like to welcome you again and to thank you for agreeing to be here this morning to share with us. So if you would go ahead and tell us about yourself a little bit and Rebirth House, whatever information you wish to share with us, we'll be very appreciative this morning.
Thank you very much, Mr. Dwarka. Good morning, Mr. Dwarka. Good morning, listeners. Good morning, viewers. Well, you can call me Jeff, but I'm Mr. Jurawan, clinical psychologist. I am presently the clinical psychologist at Rebirth House, an organization which has been in existence since 1988.
Wow.
In fact, the inception of the organization is marked on the 27th of June each year. That is the birthday of the founder. The founder is Mr. George Maximum Tambi, who through his own experience and intuition and inspiration from the Holy One was able to understand the plight of people who are afflicted with the disease of addiction. And he able to take his experience of following the path of addiction and understand and empathize with those who are suffering. And he lobbied and advocated the government to begin to get somewhere to at least begin to develop some facility whereby intervention could be meted out to individuals who were suffering with addiction at that particular time. So the center started in 1988, and during that time, well, we know in 1988 it was more alcohol addiction at that point, as Mr. Dwarka will tell you. There was more alcohol, there was more some marijuana as well, but as the years moved on, we had marijuana increasing in use, and we have cocaine increasing in use as well. So we had to adjust our approaches to suit. And now at that time we had about 4 or 3 centers, and then we had probably 4 centers over the couple of years. But right now we only have 2 facilities. But we are Rebirth House, and our business is rehabilitation and treatment of individuals who are afflicted with the disease of addiction. And you may want to say, what is rehabilitation? We use the word rehabilitation very loosely. What does it imply? What does it mean? It really means, you're exposing an individual to some level of program because they would have experienced some disability, some experience, whether they have a mental health issue, whether they have a medical issue, whether they may have a traumatic event, and they need some assistance to bring them back to normalcy. All right, so we expose this to a program for 3 to 6 to 9 months, because those are the 3 phases of our program. Right. And we expose it to some skills and some techniques, in addition to some counseling to bring you back to the point whereby you could go back into society and you could assume your role, normal role in society, and have the rights and the responsibilities and the opportunities to embrace life on its own terms. So Rebirth House has been existing from 1988 to now, but we have experienced significant and dynamic changes in the structure and the operation, because obviously when we started, we had only alcohol and marijuana, and then in the 80s we had cocaine. Right. But now, drug use now is not only limited to that. We have a host of other substances we deal with now. Right. You have things like heroin, you have things like ecstasy, you have things like methamphetamines, you have prescription drugs, you have over-the-counter drugs. So now, we now have to expand our services and don't limit it to only those type of drugs, because Mr. Dwarka will tell you, and I will underscore the fact that if we have people coming to the institution for assessment, we have a processor, and I will come back to that in terms of our process and our programs, but that's giving you the nature of the situation that we're dealing with at present. So out of 10 people who present for assessment at our facilities, at least 4 out of them, those people, or 5 of those people.
If I may interrupt you, Mr. Jurawan, I think you turned off your video by accident.
Okay.
Yes.
Okay. Yes. I hope it wasn't a long time ago.
No, it wasn't too long.
All right. So I was saying then, the whole issue of addiction has evolved from where it was in 1988 to where we are now, because we have people now presenting, coming for assessment, and they don't only have alcohol or cocaine or marijuana use.
Right.
Now you have many other things in addition to that. You may have a little bit of ecstasy, a little bit of methamphetamine sometimes, which you don't talk about. In addition to that, you have chemical dependency on one side, but you also have the behaviors on the next side. So right. you have chemical use, cocaine, marijuana, alcohol, and you have gambling. Yes. You have marijuana, cocaine, alcohol, and you have internet. Right. You have cocaine, marijuana, alcohol, and you have pornography. Yes. You have cocaine, marijuana, alcohol, and you have gambling, online gambling, or shopping, or even in activities like physical activities and sport. could be also addictive. Even criminal behaviors could be addictive. So what I'm trying to say, Mr. Dwarka, is that the disease of addiction has evolved.
Correct.
People tend to use the word addiction synonymous with substance use disorder, but it is not. Addiction is the umbrella term. But there are two basic, two sides of two different banners under which we could look at addiction. Process addiction on one side, which is behavior, and chemical addiction on the next side. So in essence, I'm trying to say that disease has become more like the definition. Like Mr. Rauka would have told you, the disease is it is complex. The disease is chronic. The disease is progressive, and the disease is it is very dangerous, right? So it could be very fatal. Addiction left untreated, as Mr. Dwarka would have told you before, it can be very fatal. So now, over the years, now we have now kind of remodeled our approaches to try to cater for the evolution or the revolutionization of addiction of where it is now.
All right.
Having said that,
yeah, I know you said there used to be 4 centers, but you're down to 2 centers. I remember the center at Trafford Court, and there was the center also down at Carenage. There was one going down to Macquarie Bay as well. So which of the centers are in operation right now?
So the centers that are in operation now is a facility that we have in Belmont,
right,
which is opposite the Queen's Park Savannah. It is Jerningham Avenue.
Right.
All right. And then we have a center in Shagaramas, Macrib. That is where if people who will know, there was a youth camp before on the Voluntary Defense Force headquarters. Right. We are there. We are allowed the space there. So we have those 2 treatment facilities, and our office is at Trafford Court.
Right.
So at Belmont, we can house up to 10 people, because that's when the detoxification phase occur. And the rehab phase occur in Shagaramas, where we can house up to 25 to 30 people.
What is the process, Mr. Jurawan, for entry into Rebirth House? What are
right? So the thing is, when you a family member or the individual called, there are certain prerequisites for screening. We will ask you for STI screen, sexually transmitted infection.
Right.
We ask you for a TB test as well, because really that is very good. Since smoking is associated with the respiratory system, some respiratory symptoms could mimic, or be similar to the TB symptoms now. So in order for us to at least be able to discriminate, to a large extent, what is what, and then TB is very highly contagious.
Right.
Right. So that is something we can't compromise at all. Even though we have difficulty with the man-Tooks test, there are other screeners that we will ask for.
And let me just remind our listeners, coming from last week's program, and I know you would know Beverly Mawson of Serenity Place in South, and she was referring to the same reasons why that people coming in intended to be who seeking admission must be properly screened health-wise, because you don't want to bring in anyone with a infectious condition like TB to infect the rest of your population. You want to assure the family members that their siblings, whoever they have their dissenter, is now in a safe and sterile environment, health-wise as well. So I thought I'd just reinforce that. Yeah, so you were saying one of the requirements is to...
I'm happy that you stick that in. So the STI, the TB, well, if you do come on that day, and you do have some suspicious flu symptoms, we will administer a COVID screener.
Right.
Whatever we're doing, we have to maintain the rights of the clients in the institution. Correct. Anything that is contagious, we're really trying to to have individuals in a very safe environment. They're already on the streets, and they're already vulnerable. So when they come in here now, we try to give you a little protection by not taking people who are infected. However,
I just want to throw this at you, Jeff. The fact is, the reality of the situation is that addicts and alcoholics in their chronic stage, they're not very easy to deal with. They become a really heavy burden on their family, because of the embarrassment they cause, because of the activities they engage in, some of them stealing to support the habit. You can't trust them in the house and all of that. So a lot of family members, from my own experience, and I know you have worked at Pipara, I forget to mention that you were a psychologist there as well. A lot of family members look for any opportunity to just get this person out somewhere of safety. Hopefully that they'll go to a rebirth house and you people will do something with them and make them come back like how they, rehabilitation as you
Well,
explained.
Mr. Walker, I just want to share with you though, and I want to
Yes,
emphasize it. I want to emphasize to the listeners.
yes,
And you said it in your preamble, your opening of the program is that we deal with a disease,
right,
a disease that is chronic and progressive. And I want the listeners to understand as well that it is a disease similar to diabetes, and it is a disease similar to hypertension,
right,
and it's a disease similar to maybe heart heart situations as well. So,
right,
but it is treatable. Like the others, it is treatable. And I also want to emphasize that individuals who are afflicted with some form of addiction, who are afflicted with the substance use disorder, did not set out in the first place to become where they are. They did
right,
not. Like
correct,
any teenager or any young adult who go through the phase. Well, Mr. Walker, you'll understand the developmental psychology and what
yes,
happens in adolescent and what happens in young adulthood. That phenomena of experimentation. Because
right,
at the end of the day, human beings, Mr. Walker, once arousal. Human beings want reward. How human beings want pleasure. And any
right,
activity that will get them that, because that's a natural inclination of the human
right,
element to get arousal. I mean, some people read a book and get aroused.
right,
Some people see a movie and get aroused. Some people go to a KFC and get aroused, and they may do many other things because it is a normal human phenomenon.
yeah,
So we had to understand from that perspective that individuals who are where they are today in relation to some aspects of addiction did not choose that. Because here what? People brain are wired differently. People brain respond differently to different activities and different jobs. People
right,
genetic heritage is also different. And there are various theories. I mean, you would have done it in your program as well. There are
yes,
various theories that attempt to understand why individuals may be how they are. So we
right,
understand that. And we say to the family as well, as bad as it is, because I have seen people come into treatment who have been in prison and who has been totally locked off, all right, from
yes,
the family member. And they try once and they try twice and they come in another time as well. And we work with them, Mr. Dwarka. But right
right,
now we have a competent staff. We work with them. And they start to do okay. And then because remember, our work with clients doesn't limit to the individual alone. We try to extend that service even to the families. We
correct,
begin to do family work as well. I ain't reached the program part yet. But we really try all within our remit to help that individual because we realize that the individual is not well. And you understand as well, with the whole issue of mental health, the more you use, it's more you begin to demonstrate some psychotic symptoms, some depressive symptoms, some anxiety symptoms, or whatever. So they are very sick people. So we understand that, and we take it not from a moral framework, but we take it from a disease framework and try our best. However, we may not. Everybody would not come out unscathed. There are those who will relapse and come again. There are those, Mr. Dwarka, that we cannot treat because they get to know the system so well. They become so conditioned to what happens there. They come in, they fit in, they go to the routine, they go and they come again. So, that is where our competencies and our assessment skill will determine who we take and who we do not take. But in essence, you were talking about the TB patient with Ms. Morrison reference last week. We do not refuse no client. And let me explain that to you. So you come to our institution and we assess you. And you're presented not only with a substance use disorder, but you're also presented with a mental health disorder, which we realize that we can't manage. We do not tell you that we're not going to take you, right? We try to get the family to hear what we do a referral. We are saying on that referral that you came for admission today, and we do an assessment, and it is in our opinion that you're presented with X, Y, and Z symptoms, and if you are referring to an institution for possible assessment and treatment with the intention of having you come back into the institution when you are stabilized.
Right, correct.
Or we refer you to another institution. We do not ever allow you to leave our place without
All right,
telling you it.
Jeff, I think we have a caller on the line.
Sure.
So, hello, caller. Hello.
Mr. Jeff.
Yes.
What I'd like to know is the services rendered at Rebirth House. Is it voluntary or is it or are you all compensated remuneration?
Some of us we have two different categories of staff. We have the monthly staff, and then we have the contract employees who are paid by sessions, and then we have the voluntary staff as well.
And where does funding come from?
Well, we are 60% funded by the government, and we supposed to raise 40% of our operating costs.
Okay, right. Thank you very much for the information. Yeah.
You're welcome, sir. Always a pleasure to serve.
All right. I want to thank that caller for calling. You know, he's raising some very pertinent questions, which of course, it is important for the public to realize that this started as a personal effort. I had the good fortune, you know, Jeff, to meet Maximin himself. He would come up.
Maximum Tambi.
Yes, Tambi, his name was. And he will go into these blocks, in these hellholes, and pull people out and bring them to Cora when I was there and sit with them and make sure they saw the doctor. And, you know, we really must celebrate people like himself. He, and then followed by L.T. Richards later on. You know, these are people who have really blazed the trail. But I want to come back to your discussion, because the fact of the matter, this is seen as an individual illness, but you did mention as the individual is becoming sick, so too is the family. And this is why the family is very important. And the point I want to make, Jeff, is that a lot of people say, you know, if he only stopped drinking or stopped using, everything will be all right. But they're not prepared to look at themselves, how much they are enabling the problem or have contributed to it. So your comments on that, what do you think?
Well, Mr. Dwaka, you are a social worker, right? And you are very familiar with the system's approach of social work. And you understand the family operate like a system. Any element of that system that is inoperable, you know, to show that system's out, you know, out of sync in this equilibrium or out of balance, right? So the interesting thing with that is that in the early stages when the individual is using people begin to, you know, to Mr. Walker, once normal, stable, well-functioning, balanced families, when you begin to have somebody afflicted with substance use disorder or any types of addiction, it shows everything off. It's a lot of blaming. It's a set of infighting. Is a set of what you call denial of the situation. Is a set of compensatory behavior. So the whole system becomes chose off. And the more the individual use, is more chaos and more confusion ends up in the family where people blaming themselves for what just happened. We blaming one another. We not realizing that we have a sick one in the family. We fighting, we whatever. We're making excuses as well. We setting alibis for the individual as well. We enabling the individual as well. So it's a whole contraption of different behaviors by the family system, because it is now in a confused state. There's no longer in balance. There's no, maybe there was a trend or a model of operations previously. Now everything is going off. And the more the individual use, remember the individual who using now is the center of attraction. He throw everything off. He's the center of attraction. Life now revolves around him. He may not really be the most important person, but lives of the entire system revolves of that individual. And the more he uses, and the longer the family takes to decide to get some type of intervention or education on why it is happening, the whole thing, it will get so while it is progressive for the individual in relation to deterioration, it is progressive for the family as well in relation to deterioration.
All right, so I want to stick up in here and, we have a next call. Hello, caller.
Hello?
Hello, yes.
Hello, Mr. Dwarka, sir?
Yes, sir.
Oh. Mr. Dwarka, I'm not hearing you on the telephone.
I am hearing you quite clearly. You could go ahead if you have a question or
Okay.
comment.
Mr. Dwarka, this is the caller from Woodland I speak about.
Okay.
Honestly, for myself, I've never touched that stuff, and I don't intend to even try it in this lifetime. Never touch it. I never only want to even try it. But I like listening to this program because anywhere I go, I speak about this kind of a same situation.
Okay.
I'm fortunate enough that to never even try this stuff, and I'm very, very happy that I listen to this stuff because I could tell people about it. So I thank you for just taking my call, and I'll always be here listening to your program. Thanks.
I want to thank you very much for calling and encouraging us. And you are one of a kind. Not many people are able to be abstinent as you are. And I'm sure they can learn from your example that you don't need to use drugs to be able to live a successful life, to enjoy yourself and all of that. But coming back to our discussion, Mr. Jurawan, the fact of the matter is that a lot of people have expectations. Some people think, well, look, let's just get rid of him, send him somewhere where they could keep him and do something with him to make him brand new. And sometimes the client themselves think, well, look, I'm going for a holiday. It's the rest and relaxation, and nobody will bother me and so on. Or some people, they because they're not committed to recovery, they resist every attempt, and every chance they get to bolt from the center, they get themselves into trouble. They break the rules, just so that they will be expelled. So what are your thoughts on those?
Well, just remember, all the examples that you reiterate underscore the fact that we're dealing with a system that is confused and a system that is in chaos.
Right.
And they hold on to straws to be able to survive.
Right.
So if at that instant you have to get the individuals out, put him somewhere, and if at that individual now the individual has to go, you know what, I'm going, I just go in, and he will go in there for the first 2 weeks and he'll want to go. Those are the 3 scenarios that you painted just now.
Right.
That is okay. That is okay. It is now the remit of the people who accept him as a client to begin now to understand, because I understand everything you tell me there. Nothing you tell me there is wrong. Those are normal occurrences and normal accompaniment of individuals who are victims of the condition.
Right.
So it depends now on the institution and the clinicians now to be able to intervene now to see if it's possible, to bring about some stability in the system from the family perspective and from the individual perspective. Just remember, these are very sick people from all angles. So that is why we are called helpers. And that's why we are called clinicians, right? So we now are able to help these people in crisis. Now, the thing is, I also want to punctuate my statement by saying it is not all level playing field. I'm not saying that we have a plaster for every stone. But the fact is that we will make an attempt. More than likely, in that scenario where they say, what about if the individual may have a mental illness? What about if the family may also have some member they have a mental illness? Where they may have, what about other things in the family that may influence the way it is happening?
Right.
So that is where we come in as clinicians now to assess the reality of the situation and develop an interventive strategy involving both clients and families in relation to arresting the condition, and I say to the family and the client, and see how we can move forward. It is not even kill. It may not go as how I'm telling you, but that is the intent. Because you must have in your head a model in terms of how you, because each institution will have a model in terms of how they're going to treat with their clients. We have various models. We don't need to go into that. So that is how we would have dealt with it. I'm not saying it will be successful, but we will try sometimes midway, the family jump out. Sometimes midway, the client leave. But we will take you and we'll attempt in the first instance to touch all those aspects of the system to bring about some cooperation. Once we get the cooperation, once the family make it to cooperate, and once the client now settles, and the client now, the transient period, which that early period settles, and he begin to come back to reality now, because remember, he no longer in these days, he no longer anesthetized due to drug use. So he come back to reality now. We will take the opportunity now to see how best we can assist the individual in arresting his condition, and see how we can move him towards the point that we got him at, the other points as well. But I'll tell you something as well. People, and I'm just sticking this on the side, it may not be all relevant. Some individuals do not want to stop drinking and smoking. That's the reality.
Right.
Because for that stop, I tell somebody to drink, and I do not tell people don't drink and don't smoke. I do not do that. That is a value statement. I cannot do that as a clinical psychologist. What I will tell you, these things that happen to you are result. And if you want to better your situation, you need to go for where to start. What causes it? And if you continue, that is what's going to happen. I cannot impose my value and say, Mr. Dwarka, don't drink. No, that is, as a professional, I cannot do that. But I can tell you, these are the factors that cause it to drink. And I can tell you, if you continue, that will happen, you have a choice. And I will say, you could go to AA, you could go to NA, you could go to church, I will tell you that.
Right. So I'm glad that you're saying this, because there's a heavy responsibility on clinicians and people in the helping profession. It doesn't matter what brought the person to you. Some people will come because of the pressure from the spouse, the pressure from the employer, or they were referred by the court system and so on. It doesn't matter whether they have insight or not. It becomes, to my mind, and I agree with you there, it is the clinicians, it is the therapist's responsibility, the institution's responsibility to take them from where they are and help them to develop insight. And it is from that insight they will develop the motivation. And yes, they always have the right to self-determination. We can't
always.
In fact, before I started this program this morning, I saw 2 patients from 7 I've been working and with similar problems. And I have to remind them as well, look, it is your choice, whether you want to do or not. But I will give you all the information to help you to make informed choices. So if you would walk us through your program, somebody comes their first day, what they can expect if they came to Rebirth House.
Excellent. Thanks. I was getting there, but I'm happy that you're guiding my thinking. Thanks for that. So, yeah, there are various stages of our rehabilitation program. Rehabilitation program is you developing a set of skills to go back into society to reduce disability and enhance the ability to negotiate and interact with the environment. So you present yourself to the office. Let's say you have your TB test, you have your HIV test, you have your COVID test, and we ask for a small contribution of $750. But think about $750 per month or 9 months. $750 really, I mean, for what how much $750 could do for a human being who eating, sleeping, getting therapeutic intervention, and all the programs. So it's just a basic contribution.
It's a very economical way of, it's a very economical way of living. To get board and lodge for $750 a month, I could do with that myself.
But it's something like here, at least give a little contribution, man.
Right, I understand.
But we do not. If we do an assessment and we realize that you really want to come in and you cannot afford it, then we admit you still. We go to do admission tomorrow, and that may happen to us as well. So you come to admission, you come to the screening. We have 3 members of the panel who is going to screen you, ask the questions, do the biographical intake and all the other intake. We assess you on the somatic level, which is bodily and physical, medical illness, mental as well. We do that as well, and we are social as well. So we do the assessment. We say, okay, you may or may not have any co-occurring disorders. So we either refer you to another institution or we decide to take you. So we're going to take you. First scenario is we're going to take you finally. So we admit you, and then after we admit you, after we got all the information, contact family members if you have, whatever it is, let them know you're here. Then we admit you, we put you into the first phase of the program, which is called the detoxification phase.
Right.
That is about 2 weeks. Detox phase is where you eat, rest, and you just relax. You're not actively involved in any activities, because this is the time you need to rest and help the body rejuvenate. Because alcohol just beat you. Drugs just beat you. You're tired and you're sick and you want to rest. The brain want a little reprieve.
Right.
So you're giving the brain, which is the organ most impacted by alcohol and drug use, a time to rest. So that now we can go into the program or the rehab program after 2 weeks now and start to get into the aspects of the program.
Right.
So after 2 weeks now, we send you into the rehab program now. That is where you're exposed to different activities. And Mr. Dwaga, what are the activities? Well, obviously you have individual counseling between you, like you and the client this morning. Then you have group counseling as well, where somebody will talk to the entire group. Then we have a structured program, Mr. Dwaga, from 5 o'clock in the morning to 10 o'clock in the night. There's a structured program. Yeah, because drug use and alcohol use is an unstructured activity. It is structured according to the using and finding ways and means to move more. So we restructure you in relation to live a life without drugs. So time to wake up, time for prayers, time for exercise, time for something you call occupational therapy. That is where let's say that first component of OT is where you take care of the institution, where you clean outside, you clean the table, you wash the wares, a kind of therapeutic community model, something, Mr. Dwarka, right? You get up, you do something. Do something to maintain, whether it's the toilet, whether it's the bedroom, whatever, everybody put a hand to maintain. And now after that, you take a bath and you come and take your breakfast. Right. After breakfast, now you prepare for your first session at 10 o'clock.
Right.
10 to 11, 10 to 12, you have session. 12 to 1 is lunch. 1 to 3 is rest. Why do you need rest though? Why do you need rest? Because remember, think about brain damage. Think about how people memory, concentration, attention, how people are motivation, their ambition, their ability to stay up long. No. Your concentration wanes. So here one, take a rest.
Right.
Break the cycle. Come back out in the evening and engage your brain and the body again. That is the reason why.
Right.
There is a therapeutic and a clinical reason why rest time is suggested. You come back in the evening as well, then you may have a group in the evening as well with a peer counselor. You have an any meeting, and then you have recreation, and then you have dinner as well. Then you have a little bit of a recreation time. You want to watch TV, you want to play a ball game. Lights out at 10 o'clock. You do not have a choice whether to do that or not. Because we are trying now to recondition your mind in terms of how to function with a structure in preparation for your reinstatement of society. Same thing when you discharge, you'll go up 5, you will take exercise, you will say your prayers, you will prepare for work, you will go to work, you come back in the evening, etc., etc., etc. So the model we are giving you, you have a designer model. We help you design a model for life into society. So rehab take place, which will be, as I said to you, we have the 3 months, 6 months, and 9 months program. It is adapted based on individuals were in rehab before. If you were here if you were in a rehab 4 or 5 times, and you know about the program, and you just want a refresher in terms of remind you of the skills and competencies, because really actually, to stay clean requires skills. To stay clean, it's really skills to stay clean. It's really techniques to stay clean. It's really strategies to stay clean. So remind you, prepare yourself, so we kind of refresh your toolkit for reinsertion into society.
So in other words, you have a follow-up program for your clients.
We have a follow-up program, we have an H&I program, but we also have a relapse program.
Right.
So the 3-month program is a relapse program, right? Okay. The 6-month program is those who can't make 9 months. Those who can make the 9 months, but again, it really depends on the nature of your condition. How bad you are in terms of mild, moderate, severe, profound, in terms of your substance use disorder. So you have you go to the rehab program and you have the occupational therapy, you have some gardening, we have some animals as well, you have spirituality as well. So we try to give you a well-rounded something. In preparation for discharge, we have family sessions as well. So right. So we have different categories of staff. We have the peer counselors who individuals who are recovering as well. Then you have addiction counselors who may have experience in counseling and have the degrees and so. And then you have me as a clinical psychologist who is clinically trained. All right, so you have 3 different categories of staff to do intervention with the clients at various times of their stay at the institution. Right? So, but we may have clients who may come and they may have a little bit of depression or anxiety or even schizophrenia or bipolar, but it's moderate and they're on a medication and we can manage them. They are here. If we can't manage you, we will don't take you. So you go to your clinic appointment.
As you say manage, I think about rules. I know at Piparo we had rules at most treatment facilities. There are certain rules that there are certain rules that you can't break at all. Like, for instance, you are not allowed to bring drugs or use drugs while you're there.
If you use drugs at the compound, you are automatically dismissed. You sign a contract in relation to the rules, and there is no second thought. You're violent and disrespectful to authority. We can't take that. You're bringing drugs. That is one of the biggest crimes you can ever do in an institution. You come and bring drugs into a compound. Right? We don't tolerate those things at all. In fact, that's not our decision. You decide to get expelled when you do that. That's your decision. Because we have to think of the other clients who are at risk. All right. So we have the rehab program, but we prepare for discharge. You the last 2 months, we prepare for discharge. What are you going to do for reinserting into society? You go home for weekend passes. You start to go to your meetings on the outside. You start to go to your church. You get back the family meeting and the family support. You get back your friends in the workplace. We touch back the workplace. You can go back onto work, or we try to get back your job. So really and truly, we help you in preparation for discharge into society. When you go,
what would be your comments and your success rate as far as you are aware?
But you see, when you deal with a disease, you see that's a very complicated question, and sometimes I like to kind of qualify it. You're dealing with a disease where it really depends now on the individuals to practice the skills and techniques that we taught you, right? And we're trying to work on that a little more dedicated now, so people will leave with a better understanding and acceptance of the role. But the international statistics continue to say that in the first year, between 60 to 70% will go back. That's in the condition. You're dealing with a brain disease, Mr. Dwarka.
I'm asking that deliberately because you see, family members would quickly say, well, he went to Rebirth's house, he went to Cora, and it didn't work. Not realizing that if the
that is okay.
Yeah.
That is okay. That is okay, Mr. Dwarka. The disease is highly relapsable. Diabetes is relapsable. Hypertension is relapsable. People just knowingly go and eat ice cream, is a diabetic. People just knowingly go and eat once a right because they have heart. People just eat KFC on a Friday and they have hypertension. We just do things, we take risks, and we have slips. So let me make the point. Let me make the point, Mr. Dwarka. Hold on. The point is, if we do make a slip, that is not the end of the world.
Correct.
If your patient or your family have a relapse, that is not the end of the world. That is the nature of the condition. Exactly. It just is to say, now you have to refocus. You have to break the cycle. Get back to do what you had to do. Set back, you go back into the straight of operations and get it correct. It will happen. Some people will go and come until they get it right. But at the end of the day, Mr. Dwarka, everybody who is afflicted with the substance disorder, if they make the correct choices, they can recover.
Well, Mr. Jurawan, listen, when we're having a conversation like this, time seems to fly. I am thinking, I know we didn't go into so many other details, time did not permit, but of course, there's always the opportunity to do a part 2 to this, and I'm hoping that if necessary, you would be available. But I want to thank you today for coming, and I know, I could see how passionate you were to share so much information with us, that I'm letting our listeners know that even though the program will end in a few minutes, they're still quite willing to call me. And if you want to share your numbers, your contact numbers, Jeff, with us, we could share it with our listeners.
I think I will do that. So our office contact, and if you want to write on the screen, you can do that. The 627-1673.
271.
627.
627.
1673
Hold on. Let me get that again. 627.
1673.
73. 627 1673.
And my contact is 366
366.
4043.
4043. Okay.
And you can check us. You can check us online, rebirthhouse.org.
All right. Good. Good.
Check us there. Connect with us. Call me. And I'm saying to you that I'm saying this on your program, Mr. Dwarka. If there are individuals, there are listeners and viewers outside who may have a little bit of reservation in terms of if it, for themselves or for a family member, in terms of something in relation to addiction, whether it's process addiction or chemical addiction, and they want an opinion on the status of the person they're dealing with, they are free to call the institution and we'll call them in and we'll give them a free assessment. And we give them a free assessment and then we'll guide them along in terms of how they should proceed if they want to.
All right. So again, I want to thank you very much, Mr. Jurawan. You know, I'm so familiar calling you Jeff, you know, for agreeing to come on the program and sharing your wealth of knowledge with us. And of course, I know after the program, we'll be getting a lot of calls. That's how it happens. A lot of people, you know, they don't call directly because they worry that their voice might be recognized. But I want to thank the callers who did call and make inquiries and support the program. And to let all our listeners know, this program will be repeated again at 10 p.m. tonight on both radio and television. And in a few minutes, it will be posted on YouTube and Facebook that they could access it on that platform, and they can also give referrals to whoever they wish to. If they know of anyone who has a problem, they can give the referral, or they can call me at 671-3040, 671-3040, and I'll be only happy to also treat with it. So again, thank you very much, Jeff. And
it definitely has been a pleasure, Mr. Dwarka. Always a pleasure to serve the man, service the God, and service the society.
Thank you again. So thank you all, everyone, for listening to the program this morning, and see you all again next week, Thursday, same time, same station. Bye.